minutes to the senator from Georgia.
Senator from Georgia.
I thank the ranking member on the Finance Committee for his allowing me to speak here for a few minutes to simply respond to some of the statements, just as Dr. Coburn has just done, that were made earlier, and my friend from Massachusetts, who I know whose heart's in the right place, and talked about the AMA as if it were the last word in the medical arena being in support of this bill. Well, Dr. Coburn is a practicing physician, and he can speak to this maybe even better than I can, but what we know is that the AMA represents 10% of the practicing physicians in America. 10%. That means 90% of the docs in America do not belong to this group that has sent this letter in support of the Senate bill. And I speak to this with authority because my phones have been ringing off the hook since this debate started months ago. The calls coming in from docs around the state of Georgia who are violently opposed to the Senate bill as it was being discussed and as it came out of the closed-door session that took place across the hall after the leadership in the Finance Committee, after the leadership in the Health Committee could not agree on the direction in which we want to go. And the senator from Massachusetts said that we're here scaring seniors. Well, I hope we are. Seniors ought to be scared. They ought to be scared to death of what's going to happen here because we're taking almost $500 billion out of Medicare, a program that a bipartisan Medicare commission has said is going broke, and the senator recognized this. It's going broke. And we're taking $500 billion out of that, whether you agree or disagree that the cuts in Medicare proposed by the Democrats are legitimate or not. We ought to be taking that money and putting it back into Medicare to save that program for the long term. The senator from Tennessee asked the right question to the senator from Montana, and he took 10 minutes responding to the question, and Dr. Coburn's right. He did not answer the question, and there's a good reason why he didn't answer the question, because there is no legitimate answer to taking this $500 billion out of Medicare and creating an entirely new entitlement program that in and of itself is destined to go broke. And if seniors are not scared by what we're saying, simply go to your doctor. Go to your doctor and ask your doctor about this. I know what happens to patients, Medicare patients, who go to physicians who are generally in the range of 45 years or younger. Those physicians are not taking additional Medicare patients or any Medicare patients because they can't afford it. The reimbursement rates to the physicians are less than the cost of the services that they render. And the senator from Montana said, well, we understand that, yeah, there's $250 billion in reimbursements over the next 10 years that we need to take care of and we're going to take care of, and I appreciate that because we need to. But it's in the House bill, and the House bill is $1.2 trillion. It's not in this bill, other than the one-year fix you alluded to. That's the reason the House bill is $1.2 trillion and this bill is about $800 billion. That's the sole difference in the two, basically. But we're going to be coming back, and in addition to the $800+ billion expenditure in this bill, we've still got a hole to be filled to try to take care of these docs, or there's going to be a wholesale refusal on the part of the medical community to see Medicare patients. That should scare seniors. So I hope that message is getting out there. I want to close, Mr. President, with one other response to my friend from Massachusetts who said that the National Association for Home Care and Hospice is the leading organization in America in dealing with this issue, and we ought to listen to them. Well, let me tell you what they say about what's going on in my state. And I quote from a letter that's already been introduced. It's dated December 4 from the Georgia Association for Home Health Agencies. In this letter, the executive director says, according to a study conducted by the National Association for Home Care and Hospice, under Senator Reid's bill, 72% of home health agencies in Georgia will have negative margins by 2016 in the Senate bill. and approximately 68% of the 100 Medicare certified home health agencies in Georgia will go out of business, and the patients they serve will be re-hospitalized or forced to seek alternative, more costly care. Well, I don't know how it is in the other 49 states, but I want to see our patients, our Medicare patients in Georgia, do what they want to do, which is stay at home for the most part and receive the good home health care that they're getting today, which frankly allows them to live a better quality of life and a longer life. And it's
Senator's
pretty
time has expired.
From this letter that that's not going to happen, and I would yield back, and I thank the ranking member.
Where's the senator?